Imagine your blood vessels as highways, letting your blood flow smoothly. But what if a clot suddenly appears and causes a traffic jam? That's thrombosis. It blocks blood flow and can be very dangerous. In this video, we'll explain what thrombosis is, the different types, and the signs and symptoms you should never ignore. We'll also share some natural ways to prevent it, so stick around until the very end. What is thrombosis? Thrombosis is a medical condition characterized by the formation of blood clots, or thrombi, within blood vessels. These clots can obstruct blood flow, leading to a range of complications depending on their location and severity. There are two main types of thrombosis. Type 1, venous thrombosis. This type of thrombosis occurs within veins, which are responsible for carrying oxygen-depleted blood back to the heart. When blood flow becomes sluggish or disrupted, clots can form, leading to conditions such as deep vein thrombosis, DVT, or pulmonary embolism, PE. DVT typically affects the deep veins of the legs, causing pain, swelling, and potential complications if the clot breaks loose and travels to the lungs as a pulmonary embolism. Type 2, arterial thrombosis. Arteries carry oxygenated blood from the heart to various parts of the body. Arterial thrombosis occurs when blood clots form within these vessels, usually as a result of atherosclerosis, a condition characterized by the buildup of plaque on arterial walls. Arterial thrombosis can lead to serious consequences such as heart attack or stroke, depending on the affected artery. The formation of thrombi typically involves a complex interaction between factors such as blood coagulation proteins, platelets, and the inner lining of blood vessels. Changes in blood flow patterns, damage to blood vessel walls, or an imbalance in the factors involved in clotting can predispose individuals to thrombosis. Signs and symptoms of thrombosis. Sign number 1, pain or swelling. Thrombosis can cause localized pain and swelling in the affected area. The pain may vary in intensity, ranging from a mild ache to severe discomfort. It can be constant, throbbing, or intermittent. The swelling occurs due to the accumulation of fluid and disrupted blood flow, making the area appear larger and feel tender to the touch. Sign number 2, redness and warmth. When a blood clot forms, inflammation occurs in the surrounding tissues, leading to redness and warmth. The affected area may appear reddish or flushed. The warmth is a result of increased blood flow to the site as the body's immune response attempts to eliminate the clot and promote healing. Sign number 3, skin discoloration. Thrombosis can lead to changes in skin color near the clot. The affected area might become pale, bluish, or even develop darkened patches. These discolorations occur due to reduced blood flow and diminished oxygen supply to the tissues, causing cellular damage and altered pigmentation. Sign number 4, unexplained shortness of breath. If a blood clot migrates to the lungs, it can cause a pulmonary embolism. This can result in sudden, unexplained shortness of breath. Breathing may become rapid and shallow, accompanied by chest pain and coughing up blood. The clot obstructs the blood vessels in the lungs, impairing oxygen exchange and putting strain on the respiratory system. Sign number 5, dizziness or fainting. When a blood clot travels to the brain and causes a stroke or transient ischemic attack, TIA, it can manifest as dizziness or lightheadedness. The interruption of blood flow to the brain affects neurological function and can result in sensations of spinning, unsteadiness, or feeling faint. In severe cases, it may lead to loss of consciousness or fainting. Sign number 6, abdominal pain. Thrombosis in the mesenteric arteries, which supply blood to the intestines, can cause severe abdominal pain. The pain is often described as cramping, sharp, or severe, and it can be constant or intermittent. It may worsen after eating and can be associated with nausea, vomiting, and diarrhea. Reduced blood flow to the intestines can lead to tissue damage, intestinal infarction, and severe abdominal symptoms. Sign number 7, coughing up blood. In some cases, thrombosis can lead to blood clots forming in the veins of the chest. This can cause a condition called deep vein thrombosis, DVT, which can result in blood clots traveling to the lungs, causing a pulmonary embolism. One of the symptoms of a pulmonary embolism can be coughing up blood, known as hemoptysis. This can range from small streaks of blood in the phlegm to a more significant amount of bleeding. Sign number 8, chest pain. A blood clot lodged in the arteries of the heart can cause chest pain or angina. This pain may feel like pressure, tightness, or a squeezing sensation in the chest. It can radiate to the arms, shoulders, neck, or jaw. If the clot completely blocks blood flow to the heart, it can result in a heart attack. Sign number 9, weakness or numbness. When a blood clot disrupts blood flow to the brain, it can cause weakness or numbness in one side of the body. This may occur suddenly and affect the face, arm, or leg. It is an important warning sign of a possible stroke and should prompt immediate medical attention. Sign number 10. Leg cramps or tenderness. Deep vein thrombosis, DVT, a type of thrombosis that occurs most commonly in the deep veins of the legs, can cause leg cramps and tenderness. The affected leg may feel warm, tender, or swollen. The pain might worsen with standing or walking and can be relieved by elevating the leg. Remember, if you experience any signs or symptoms of thrombosis, it's important to seek medical attention promptly for proper evaluation and appropriate treatment. Before we proceed to the risk factors for thrombosis, be sure to hit the subscribe button. Risk factors for thrombosis. Several risk factors contribute to the likelihood of developing thrombosis. It is essential to be aware of these factors and take preventative measures. Common risk factors include: Number 1. Prolonged immobilization. When someone remains immobile for extended periods, such as after surgery or due to limited movement, the blood flow in their veins slows down. This stagnant blood flow increases the risk of clot formation. Blood pools in the lower extremities, promoting the development of clots in the deep veins known as deep vein thrombosis, DVT. To minimize this risk, individuals should try to stay active, move their legs frequently, and perform exercises when possible. It is also important to take breaks during long trips or flights to stretch and walk around. These simple actions help maintain healthy blood circulation and reduce the chances of thrombosis. Number 2. Surgery and trauma. Surgeries, especially procedures that involve the lower limbs or abdomen, can disrupt blood flow, damage blood vessels, and cause inflammation, all of which contribute to clot formation. Traumatic injuries such as fractures or severe muscle damage also increase the risk of thrombosis. In these cases, the body responds by releasing chemicals that promote blood clotting and healing. To prevent thrombosis, doctors may prescribe medications like anticoagulants or recommend the use of compression stockings to improve blood flow and reduce clotting risk during surgery and recovery. Number 3. Cancer and chemotherapy. Certain types of cancer and cancer treatments, including chemotherapy, can elevate the risk of thrombosis. Cancer cells release substances that activate the clotting process and make the blood more prone to clot formation. Chemotherapy medications can damage blood vessels, further increasing the likelihood of developing clots. Cancer patients undergoing treatment should be closely monitored and may be prescribed anticoagulant medications to prevent clotting. Number 4. Smoking and tobacco use. Smoking and tobacco use have detrimental effects on blood vessels, making them more susceptible to clot formation. The harmful components in tobacco products can cause damage to the inner lining of blood vessels, triggering inflammation and the release of substances that promote blood clotting. Additionally, smoking increases the risk of atherosclerosis, a condition where fatty deposits build up inside blood vessels, further obstructing blood flow. To reduce the risk of thrombosis, quitting smoking or avoiding tobacco use is crucial. Number 5. Hormonal changes. Hormonal fluctuations during various stages of life, such as pregnancy, menopause, or the use of hormone-based medications like birth control pills or hormone replacement therapy, can increase the risk of thrombosis. Pregnancy puts pressure on the veins, slowing down blood flow. Hormone medications can affect clotting factors in the blood, promoting the formation of clots. It is important for individuals experiencing these hormonal changes to discuss their medical history and any potential risk factors with healthcare professionals. Depending on the situation, alternative contraceptive methods or hormone replacement options with lower clotting risks may be recommended. Number 6. Inherited disorders. Certain genetic mutations can predispose individuals to an increased risk of thrombosis. For example, mutations like factor V-Laden, prothrombin G20210A, or antithrombin deficiency impair the normal functioning of clotting proteins, leading to a higher likelihood of clot formation. People with these inherited disorders are advised to inform their healthcare providers, who can assess their specific risk and take appropriate measures to manage thrombosis. Number 7. Age. Advancing age is a risk factor for thrombosis due to various factors. Blood vessels may become stiffer and less elastic over time, leading to reduced blood flow. Age-related conditions like obesity, diabetes, and hypertension can further contribute to clot formation. Additionally, older individuals may have a higher prevalence of underlying health conditions that increase the risk of thrombosis, such as cancer, heart disease, or chronic inflammatory conditions. As a result, healthcare providers pay close attention to thrombosis prevention strategies in older adults, which may include regular physical activity, healthy eating habits, and regular medical checkups. Remember, The presence of one or more risk factors does not guarantee the development of thrombosis, but it increases the chances. It is always important to consult with healthcare professionals for personalized advice based on individual circumstances to effectively manage the risk of thrombosis. Natural prevention method for thrombosis. Number 1. Regular exercise. Engaging in regular physical activity, such as brisk walking, cycling, or swimming, promotes healthy blood circulation. Exercise helps prevent blood from pooling or stagnating, reducing the risk of clot formation. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Physical activity also helps maintain a healthy weight and overall cardiovascular health. Number 2. Maintain a healthy weight. Obesity is a risk factor for thrombosis. By maintaining a healthy weight through a balanced diet and regular exercise, you can reduce the risk of blood clot formation. A healthy weight contributes to better blood flow and reduces strain on the circulatory system. Number 3. Hydrate adequately. Staying properly hydrated is important for preventing a thickening of the blood, which can increase the risk of clot formation. Aim to drink an adequate amount of water throughout the day. Adequate hydration also supports overall cardiovascular health. Number 4. Eat a balanced diet. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats is essential for optimal cardiovascular health. These foods provide important nutrients and antioxidants that can help maintain healthy blood flow, reduce inflammation, and decrease the risk of clot formation. Number 5. Avoid prolonged immobility. Prolonged periods of sitting or standing can reduce blood flow and increase the risk of clot formation. Take regular breaks to stretch, walk around, or perform simple exercises. Avoid sitting with crossed legs for long periods, as it can affect blood circulation. Number 6. Quit smoking. Smoking damages blood vessels and increases the risk of clot formation. By quitting smoking, you can significantly reduce your risk of thrombosis and improve overall cardiovascular health. Seek support from healthcare professionals or quit smoking programs for assistance. Number 7. Manage stress. Chronic stress can contribute to inflammation and irregular blood clotting. Incorporate stress management techniques such as meditation, deep breathing exercises, or engaging in hobbies that help you relax. Managing stress effectively supports healthy blood circulation and reduces the risk of thrombosis. Number 8. Wear compression stockings. Compression stockings can improve blood flow in the legs by providing gentle pressure. They are particularly useful for individuals at higher risk of deep vein thrombosis, DVT, such as those who have recently had surgery or are on long flights. If recommended by your healthcare provider, wear compression stockings as instructed to reduce the risk of clot formation in the lower extremities. Number 9. Follow medical advice. If you have any underlying medical conditions like diabetes or hypertension, work closely with your healthcare provider to manage them effectively. Proper management of these conditions can help reduce the risk of thrombosis. Take medications as prescribed, attend regular checkups, and follow recommended lifestyle modifications. Remember, following these natural prevention methods can complement medical advice and reduce the risk of thrombosis. Always consult with your healthcare provider for personalized advice based on individual circumstances and any specific risk factors you may have. What do you do to prevent thrombosis? Let us know your answers in the comments, and for more amazing videos, subscribe to our channel.